what lifestyle factors, such as sleep or stress management, play a role in maintaining an oral microbiome?
So all of them. Yeah, so sleep. Let's talk about sleep. Sleep is super, well, let's talk about specifically sleep breathing, actually.
Yes.
So, how are we breathing when we sleep? When it comes to the oral microbiome, that's what I want to know. I want to know, are you breathing through your nose when you're sleeping? Or are you breathing through your mouth when you're sleeping? Um, and I actually like to even call it lip apart posture, because when I say mouth breathing, almost everybody pictures Napoleon Dynamite with the mouth hanging really low and that kind of like allergic face that they can't breathe through their nose. But even this is considered lip apart posture. Okay, so what I want to know is does my patient have their lips sealed all night long when they're sleeping? That's very, very important. And if you've ever slept, you know it's very difficult to know whether your lips are closed all the time, right? So some signs that your lips may be coming apart. You wake up and there's that film on your teeth. It just feels like a little fuzzy. You wake up in the middle of the night, maybe actually even feeling like you need a good drink of water. You wake up with dry mouth. That would be another sign that your lips are definitely apart. There's drool on your pillow. Somebody can hear you breathing at night. If you have a bed partner that can hear, you should not be able to hear your bed partner breathe. You should wonder if your bed partner is alive at night. That's how quietly you should be breathing. If you can hear somebody breathing, that's a sign of dysfunctional breathing. So lips need to be sealed. There's some pretty easy hacks around that. If it is pretty mild lip apart posture, we can do lip taping. We use, nasal saline sprays to open up the nasal passages before we go to sleep, and then we lip tape. So there's some pretty easy hacks. But the reason this is so important, guys, for the oral microbiome is because the minute you start to breathe through your mouth, you're drying out the tissues and you're changing the pH of the mouth. So we're getting back into that acidic territory. It's really, really difficult to have a healthy oral microbiome if your lips are apart day and night. So that's what I want to know, because it's really going to impact oral health. Not to mention, if you're breathing through your mouth at night, you're actually probably not, you may not even be getting into deep enough into the stages of sleep that you need for your brain to clean itself every night. And if we're talking about bigger inflammatory issues like Alzheimer's and dementia and cardiovascular,
Mhm.
being able to get into those deep REM stage 4 deep sleep at night is super important for detoxification and cleaning up the system. So yes, that absolutely matters. Stress affects us all, and yeah, for sure it's going to affect us. I see it most often affecting people's habits. Ultimately, when people are under higher periods of stress, things fall off the wagon, right? I'm under the gun at work and I'm going to bed super late and I'm forgetting to brush my teeth. Or like even me, the dentist, when we were shut down during the COVID pandemic, I mean, my routines were like out the window. What happened? Because there was no defined start to my day. There was no defined end to my day. It was just like, did I brush my teeth? I don't know. I didn't get out of my pajamas. So like, that's where we start to see stress affect oral hygiene and the oral microbiome for
Mhm.
sure.